Does that
Yep.
come up? Yeah. Cool.
We're good.
Cool.
So yeah, just to refresh, during the presentations I do, I normally start by asking them about themselves, because that's always a good icebreaker. What do you do? What sort of services you provide? Make sure I know if they're dom care or care homes. If they're care homes, are there multiple care homes? Is it CI Pro? Every now and then I've had some of the additional sales team pass me demos, and I'm thinking of CQC Pro, and it's Jock McTavish from Edinburgh, who's like, okay, come to see the CA Pro. So
Very good accent.
yeah, well, man of many talents. So tell us about you. What's your recent experience with CQC? What do you understand about CQC Pro? Is there something specific you're looking for from a quality assurance system? In most cases, they've got an idea, and they say, well, I just want to find out more about it. Show me what it does. I think the difficult area I get quite often is people seem to be led to believe that it's some sort of care management system. So it's going to manage all of their daily audits and all of their care plans, and that's blurring the line between what CQC Pro is supposed to do and what people think it might do. So you just have to be a bit careful about positioning it and making sure people don't think it's more than it is.
Yes.
But on the other hand, I think it's pretty comprehensive in what it does do as a quality assurance system. I normally discuss it as a helicopter view or an umbrella view. So think of yourself looking down on your service, take a dispassionate view. What do you think are the strengths and weaknesses of your service? And then use this as a framework to evidence those strengths and weaknesses, and use the action plans to drive improvement. So I talk about the changes as they were originally outlined, which you can talk about if you wish. I think this is becoming less relevant now because I think people are more familiar with the standards. But I just sort of explain how we've gone from different handbooks and different sets of CLOEs for each service type to the 34 key quality statements, which are the same. The 5 key questions are the same.
Yeah.
But just relating what those changes have been. I think the key things are that it was supposed to be a dynamic rating system where providers could influence their score on an ongoing basis, and also the fact that you get these scores and you get comparisons between providers based on their scores, and a much less wordy report, a summary of the key findings rather than a great big long PDF report that you'd have from the website. So, and this slide I just normally talk around. So I'll say that certain things have changed and that certain things haven't. So you'd have the regulations still the same, the Health and Social Care Act. You have the 5 key questions, you have the quality statements, which are new, and the evidence categories, which are new. Also, the ratings are still the same in terms of overall, you could be outstanding, good, requires improvement, or inadequate, which is still the case even with the new mechanism.
Yeah.
Explain how the evidence categories apply to the different quality statements, how they apply in different combinations. So not every evidence category applies to every quality statement. And also make the point that they are predominantly about feedback. So the first 3 of those, all about what people think of the service, and having some sort of mechanism for getting feedback and storing it and keeping it, retaining it for inspections and things later, I think is really important.
Which is great for CQC Pro, isn't it?
Absolutely, with the survey tool.
Yeah, fantastic.
Then I talk about the scoring. So it really does what it says on the slide, how you've got a score for each of the evidence categories which apply to a particular quality statement. You add those up together, divide it by the maximum possible to get an overall percentage, and the score for the individual quality statement, as this is an example of, they carry forward a 3 because it related to good. So 69% would be a good score, it doesn't mean they carry across a score of 11. It means they carry across a score of 3, because 3 is the score for good. And then they do the same for all of the other quality statements, and then you've got an overall score for the key question.
Yeah.
Divide it by the maximum, see what that is as a percentage. Quite often I get asked about historical ratings and how CQC are not in practice looking at every quality statement during an inspection. So you can talk about how they've said they will bring forward the rating for the previous inspection, whether that's right or wrong. That's what they do at the moment if they don't inspect it.
Yeah.
Unless previously it was rated as requires improvement or inadequate, where CQC have said they're going to inspect every quality statement previously not rated as good or outstanding. But in practice, we've seen plenty of examples where they haven't actually done what they said, and they've still got carried over scores from previous inspections which weren't good.
Yeah, of course.
So yeah, lots of idiosyncrasies about the way CQC are putting the scores across. Talk about the portal. This is always a good one, because the I'll moan with you about the fact that portal doesn't work very well, and it's not something that does what they originally said it was going to do. So originally they said this was going to be something they could use to for providers to share evidence with CQC on an ongoing basis. So in that dynamic rating, influencing your score, I've got new evidence I want to share with CQC. The obvious way would be to send it through the portal for them to consider, but there's no functionality to do that just yet. Although when I asked Mark Sutton about it in Bristol, who's the man who would know, and he said that's very much the intention, that the portal does play a role. But I think what they're going to have to do is narrow it down so that it's not a free for all, because otherwise providers will just all send loads of stuff all the time, and they'll need an army of people to try and work out what it means and to apply a score. So I think it's going to have to be very regimented, and you'll have to provide very specific information to CQC for them to consider. But of course, that's then going to put a bit of a straitjacket around what providers feel they can or can't share with CQC, and it might mean they don't feel they're getting a fair crack of the whip in terms of influencing their score. So again, lots of problems potentially with the portal, notwithstanding the fact that the rollout of it has been a complete botch job, and the lots of providers even now are struggling to get on it.
Sure.
Briefly talk about the way CQC publish their reports. So the initial view is very similar to the previous inspection, because you get the 5 key questions, how it looks overall for each key question, and what your overall rating is. But then instead of download the full report for this provider, which is what the old system had, now you get sort of paragraphs in each area. So you get a drop down of the overall rating, and then you can drill into each of the key questions, and underneath that the quality statements, where there may be a few words against each quality statement to explain how they got to a particular score. But they don't go into the evidence categories in that much detail, because if you did that, then it's just going to expand the report and make it more difficult to understand. So this slide just really feedback on what's happening so far. So I hear from Mick all the time on the latest progress. We see things from various care bodies, and particularly the legal companies, Leicester, Aldridge and Bevan Britton and people like that, who comment on care a lot. If you read their blogs on social media, you'll see they're quite often pulling stats and figures out, which I find quite interesting and support some of these statements. I think the key things are, in practice, not all the quality statements are being covered. So that 12 out of 34 was actually CQC's own figure from the Surrey Care Show, I think it was. That was the slide that they brought up. So I've borrowed that, which would indicate that they just don't physically have time to look at every quality statement during an inspection and every evidence category. things are going quite slowly. There's a massive backlog of uncompleted inspections under the new framework. So I think there's been something like 1,000 inspections since the framework was launched under the new framework. And of those, they've only produced reports of less than 400.
Out of how many?
1,000.
1,000, right. Wow.
So where there's 30 odd thousand social care providers, they're working on a rate of doing about 1,000 or 2,000 a year. It would take 15 years to inspect everybody. And what we're seeing is a increasing backlog. Quite often when you look on the CQC website, you see sites haven't been inspected for 5, 6, 7 years even. And CQC, importantly, are supposed to inspect every newly registered site within 12 months.
Yeah.
And as of now, they're only inspecting 6.4% of newly registered sites within 12 months.
Gosh, that's an incredible stat, isn't it?
Yeah. And there's something like 5,000 unrated services.
Gosh.
Which is terrible news for the service, because if you want to attract somebody to your service, they'll expect to see a rating, and they'll want the peace of mind that you've been inspected. So it makes their lives really difficult. Quite often, the commissioners won't consider people who've never had a CQC inspection. So the local authorities or the ICBs locally will not work with providers who haven't been rated. And yeah, I've spoken to some very recently who haven't been rated in years since they've been inspected, or since they were rather been registered. And yeah, they're absolutely desperate. They're saying, you've got to register us. So yeah, against this backdrop, the chief exec resigned a couple of weeks ago. They're now being investigated by the Department of Health on behalf of the government. And you could really see that they've got to pull their fingers out and change the way they're doing it for it to work. Because at the moment, it's just not working.
No.
And what's happening is, even those people who are inspected, they're being sent a draft report, and there's an opportunity to challenge that report. So within 10 working days, you can fill in a form to say, I challenge it on this basis, whether it's just you've got inaccuracies or you should have considered this additional information, which you didn't during the inspection. And as a result, that's why we've got only a third of the inspections actually having been published, and the rest are all sitting in a big backlog. In fact, in Bristol, at the end of the day, this lady came up to me and said that she was one of the very first, part of the pilot phase in November, December last year. She still hasn't had a report because she's pushed it back and said, it's just not accurate.
Gosh.
And that's what now, 8 months ago?
Getting on for a year, really. I know that's an exaggeration, but
so yeah, it's a terrible indictment of the new system, really. So I describe CQC Pro as being really three things. The first thing is it's a self-assessment system. And the reason why they need to do self-assessment is down to Regulation 17 in the Health and Social Care Act. That's a really important thing to remember. Because if people start saying to you, well, why do I need to do this? I'm quite happy doing what I'm doing. Actually, there's a legal obligation. It's in the Health and Social Care Act for providers to carry out ongoing governance of their system. So because you can't necessarily tell when CQC are going to come and inspect you, it could be 5 years away. Who's responsible in the meantime for making sure it's a safe service? So it's actually the provider's responsibility to carry out ongoing quality assurance, and Regulation 17 spells it out, as does W5 under well-led, the quality statement W5, which I quite often refer people to in the demos, because it actually explicitly says all providers need to have a quality framework based on best practice.
Right.
Ta-da, here you are. And as a result of that self-assessment, they might find areas they need to improve, in which case we have action plans which they can apply to areas they need to improve on. They can involve multiple people in those plans and they can report on them. So it gives visibility and responsibility, if you like, for the actions that they've said they need to take. And all the while it's creating a history. So if CQC turn up in 3 years' time, they can not only produce a real-time picture, but they can prove they've been carrying out regular assessments because they've got this track record, this history of all the evidence and the action plans they've done. The second aspect is feedback. So it's really important, particularly with those evidence categories, that people's views are taken into account, because that will make a big influence on the scoring that they get. So survey templates that we provide come with CQC Pro, make it really easy to send and receive surveys and to collate the results and display them and filter them. Can you just bear with me 1 second, Rosie? This isn't going to be good on the recording.
Yeah, no worries.
Hi, Pete. Yeah. Okay. Okay, well, I've got the 24th of July as a Wednesday. Okay. Yeah. My problem that day is at 12:30, I'm doing the IHEAM West Yorkshire branch webinar, which is a bugger. Yeah, but unfortunately, it's a webinar, so which, I mean, if the meeting was at the right time, I suppose, and if Simon could let me have a room with internet access, I could do the webinar from Leeds, but it's a little bit contrived and it's not an ideal backdrop, is it? So, but I could do the Wednesday, or I could, yeah, unless he could come down to Portsmouth that day. Oh, he's based in Leeds. He's not going to want to go all the way down to Portsmouth. Could we do a webinar maybe on the 25th? Could we do it as a Teams meeting? Yeah. Yeah, and I'm at the cricket that day. I'm going to see England against the West Indies. So, yeah, can you give us some more dates? I'm on leave from the 5th week, commencing the 5th of August. Shall I drop you an email with my availability and see if we can find some common ground? Yeah, yeah. Yeah, I'm the difficult one there, maybe, but yeah, I'm keen to be there, and I would definitely make that trip. Yeah, so see if we can find some common ground. Yeah, amazing. Sorry, Pete, I'm just in the middle of another meeting, so but yes, I quite agree. It was a definite lift for the whole nation. Okay, mate. Cheers. Bye. Sorry, Rosie,
Oh,
that was
don't worry.
it's going to make a big hole in your recording. But,
Don't worry. This is just for really, I think,
yeah.
really me that I can just refer to, so it's no problem. I'll remember the the football forever because of this webinar.
Yeah,
Because of this
actually,
recording.
absolutely, yeah. So I've talked about the self-assessment, talked about the surveys, the importance of
Yeah.
feedback, and then the final bit is about data. So you can collect weekly and monthly data on the system. We call it the oversight dashboard, or the weekly, monthly audits that come with the system, to give the provider a quick view on what the numbers look like. So that's things like occupancy, staffing levels, number of notifications, things like numbers of compliments and complaints. So key information, sort of information that every provider really should be aware of, that you can collect in CQC Pro, and then we present back to them. So they've got all of that in one place and laid out. So really a health check, if you like, for their system. Because if there's a sudden spike in the numbers, they need to be aware. And if there's a worrying trend as numbers are getting bigger of certain incidents or whatever, it's a way of giving them an early warning of that.
That's great.
So the system includes all of the content that CQC themselves provide. So all the we statements, the I statements, which is the perspective of somebody in care, all those evidence categories, regulations. And for dom care and residential in England, there is the additional content that we had written by Julie Garrity, who was a recently retired ex-CQC inspector. So there's more guidance on the system than CQC provide around the evidence categories and the quality statements. So we're giving them, over and above what CQC will give them. We're giving them, specific advice on what good looks like. We also have all of those templates for the surveys and audits, which they could tweak. They can do the PIR on the system in advance if they want. And we have a RAG rating mechanism with a rudimentary scoring mechanism, so they can give themselves their own score to compare, with what CQC might give them eventually.
Sure.
So the benefits of the system, very easy to implement. It's ready to go, really. We just need to know who their users are and what service type they are, and we can get them set up literally within hours. We have everything in terms of content, so they don't need to go looking around for all the new guidance and advice from CQC. What's the latest standards, what's the latest quality statements. It's all on there. That best practice guidance, the fact that they can scale up. So if they're more than one organization, you can have overviews across all the organizations. So we have what we call directorates, where they can have a management site and see how that looks across all of their sites. They can have a quality manager or managers who can all use the system and log in and out of the various sites they might be working with, and run reports across the organization as a whole, not just as a local organization. Yeah. And to give people an idea of the scalability, when we have embarked on some of the projects with NHS, we've got the continuing healthcare version of this, which is used by every ICB in the country, as well as NHS England. We've got iQuaps, which is our pharmacy solution, which is used by 150 NHS trusts. So it is very scalable. Most care providers are only using it in a much smaller way than some of the other organizations we work with.
Great. So it's really capable of that.
Yeah. So then we talk about the software itself and go into a demo. You've got your demo login, haven't you? So
I do. Yeah, that's working fine.
Right. Yeah. So I log out, log back in. So depending on what type of site I'm working with, there are 3 sites on the demo. So you've got the residential, you've got the community service, and you've got CI Pro demo, all accessible. So
that's really handy. I noticed that earlier. It's good to have.
Now on mine, I've got a slightly different way of accessing them because I've got different access privileges, but in essence, they'll all be listed under sites. So if you're working with a residential site or a community site, just pick the one that you're working with. It's probably just nice to be showing the correct version for the organization working with, or you're demoing to.
On your home screen now, it's got the assurance, the statistics, safeguarding, staffing, and so on. That's not on the demo one that I have, unless I'm in. Just check. No, it's not in any of the ones in mine. Because that's what I was looking. That was one of my questions. Because I know it's not that new. I know that's been around for a while, but it's newer than it used to be.
Let's just have a quick look at that then. That could be a permissions thing or your user. So
Okay.
because they are there, but let's have a look. Let's see if we can fix that.
Yeah.
Because that would be the same for Nige and Michael probably then if
yeah.
If you've all got the same permissions, then it might just be that I forgot to add the right bit in. So Rosie, there you are. So Ange and Kelly have access to this part of the system where
Great.
you can make changes for users. So permissions.
And they'll be continuing to do the kind of the setup and the user access and levels and everything like that.
Yeah. Can view. I think that's the one. Let me try that.
Okay.
You want to just have another quick look in a moment? Just save those changes.
Refresh. It's not there. I'll log out and come back in.
That may not be the one, actually. Think about it. That might be to do with.
No, it's not come up unless I'm doing it too quickly, but it's not come up
no,
yet.
Must be something else.
Thank you. I was wondering if it was within the surveys and audits tab now, but I was sure that it was a home screen.
Yeah, it's a dashboard thing. Yeah, I'm sure it's against the user because the
What does
dashboard
RFI
grid
stand for?
request for information.
Oh, okay. Thank you.
So we have 3 categories of forms. You have a survey, which is generally sent to somebody outside of the organization. You have an audit, which is any form where you can reference a particular standard. So an audit is normally linked to a standard within the software. And then you have the RFI, which is like an audit but not linked to a standard. So you can use basically as a catch-all for anything else.
Okay.
Where you're not worried about then linking them to the standards. Can you
Kinda
just
like
try that?
Sure. Kind of like when you've got the generic action plan option. Is it that sort of thing? You can add more information. Not when I refresh, but I will log in and out to see if that's it.
That might be custom dashboards, might be the one. So let me just try that.
No, that's not come up.
Right, last go, and then I'm going to have to phone a friend.
It's no problem for now. It's just something I noticed. That's probably, I know it's relatively straightforward. That's probably the area I haven't really spent any time in.
Yeah. Yeah, it might be custom dashboards. Try it now.
Ah, yes, got it.
Excellent.
Perfect.
Right,
Thank
so
you.
it's custom dashboards. I got there in the end.
Lovely.
Trial and error.
Yeah.
Made it work in the end. So Just change that. I need to update Michael and Nigel. I'll do that later. Okay, so back to the demo.
Yes.
I normally just explain about the home screen. So what am I looking at here? So this is very much the self-assessment part of the system. This grid is relating to the 5 key questions. If you press the key, unfortunately, the way CQC describe what safe and effective and caring are is a bit wordy. So
yeah,
but
bigger than it used to be.
yeah,
Is it bigger than it used to be? Is it expanded
yes,
a bit?
very much so. I think
Yeah.
it used to be just like the top half.
Yeah.
Now they've got all this extra bits on. But so what this is telling you is how much evidence you have against each of the quality statements, and the color relates to the worst rated quality statement in your assessment, your self-assessment within that section. So at least one of the quality statements under safe in this example has been rated as inadequate or requires some urgent attention.
Yeah.
And then you click on the grid, or you could click on the table, or you could click on the assurance menu. So there's 3 ways in to get into this working area. And that takes you to the quality statements. As you can see in this example, everything already has a bit of evidence against it, because the little number next to the magnifying glass says I've got 4 pieces of evidence against this particular question.
Yeah.
I can edit evidence by clicking on the pencil. I can add a new evidence statement. I can delete evidence. If I decide I want to delete evidence, it will actually put it into a safe area before it completely removes it. So deleting actually moves it into an archive, and I can then look at evidence in my archive, which I might just choose to keep in there just as a historical record, but not something that I want to reflect in the live system. Or if I've made a mistake, I can restore it back to live. Or if I really do want to delete it forever, because it's nonsense, I can delete it forever. So there's options there. So it's like a soft landing. If you did delete something, sometimes through user error, you might have a user who's done something by mistake.
Great.
So you can restore it, and then it shows it as a live evidence statement again. Within the evidence itself, there are things to help people. So quite often the quality statement says, which is the bit at the bottom there, we work with people to ensure safe systems which are carefully managed, monitored, etc. So what does that mean? How do I, as a provider, come up with a view on what I need to do for that? So some will know, but some might not know very clearly what they need to do. So that's what the assistant is all about. So the assistant has CQC's guidance. So these are the evidence categories relating to it.
Yeah.
And then the stuff in the darker font there is all the extra content that we provide. So
great, and that's the stuff that
Julie wrote,
did.
yeah.
Yeah.
And I sort of frame this as a target for comparison for the people I'm talking to. So here you are, we're giving you some characteristics of a good performing service. How do you think you perform compared with those characteristics? So do you think you're very confident you do all of these things? Is there something that you're not doing that we're suggesting that could be an area for improvement? Or, is it a strength or a weakness? Basically, it's your opportunity to benchmark your service. And I think there are 2 aspects. There's one is, do you have the right policies, procedures, and training, etc., in place? So you can talk about those questions which talk about a system. Do you have systems in place? Do you have records and things like that, which are the building blocks, the processes, but also the outcomes. So what do people think? What's their feedback? What is the surveys telling you? What are the focus groups you run or whatever that might tell you what people are thinking? So we're giving them loads of targets to aim at. I'd just suggest, if they're thinking about this for the first time, think about this from your perspective. Can you confidently answer all these statements? Can you say, we do have staff with the right training? Or actually, do you have a problem there? Maybe you've got agency staff, you're not always sure about their training levels. What measures are you taking to ensure that people do have the right skills? So I don't know what those measures might be, but I'm just sort of highlighting that there is guidance in here that they can then relate to and really compare what they do with. Then we have further information.
Just having that section is worth every penny, really, isn't it? Just to give them a direction and to go in.
Yeah. And then there's this other tab here, further information, which has the I statements. So put yourself in the person you're caring for's shoes. Do they know what to do and who to contact? They move between services. Is it all planned and what arrangements are made? And then the actual definition of the quality statement, which is to do with the sort of plain English, I suppose, explanation. That actually comes from CQC themselves, but we present it back just as a way of cutting to the chase. This is what you need to be doing. So if you like the detailed, in-depth view, go to the assistant. If you just really want, okay, well, give me the headlines. What is it I need to be doing? Then I'd say that quality statement definition there is really cutting to the chase of what people need to do. And then you have what their legal obligations are. So we need to provide safe care and treatment. So we have the links to the regulations. So that's the underlying legal obligation from the Health and Social Care Act. If CQC were ever to take action against a provider, then that is what they would be citing as their justification. So it is quite clear what providers should be doing.
Sure.
So if you're any doubt, there's all that information, all linked to that one key question. Now, during demos, if you want a little cheat, what I sometimes do is I'm talking about some of these evidence categories and some of the guidance is highlight it like this, and they won't necessarily see me do it, but I'm just copying it. So I'm just going Control C or something like that, just because I want a bit of text to put in here. I don't want to be then doing bad typing and trying to work out something meaningful. So I've just borrowed a bit of text that is in context. It's come out of the recommendations. I'm not suggesting they use our text, but for purposes of the demo, it just fills it in with something that looks really credible and meaningful.
That's great. Good idea.
Then you need to explain if they want to support that evidence statement with any other documentation. So, we're talking about the fact that we've got transition plans. How can you prove that? Do you have any evidence, any records that you might be able to attach that support that? So I go to attachments, and over time, I've just created a folder with examples of things that I use as evidence. So these are just things that I've picked off the internet that I can just, and you don't really need to worry about whatever thing you attach. It's the process of attaching things, not necessarily the document you attach. So yeah, maybe start to create a little library of little things you use in demos just to attach. And the other option, of course, is the documents. So providers can save time by preloading things they want to use as evidence into the document library. We can then cross-reference a document against a particular key question. So all of these documents listed here have previously been linked to SAFE as documents which are relevant in SAFE. So you can, as a provider, upload them and then they're sat in a safe place that's all part of the system, but that you can easily then access. And if you want to know what one of those documents looks like, you just click on it and your downloads will then open a copy of that document.
And that can be any document they need. It doesn't have to be a policy
any
or
document
procedure.
Of any type.
Any document.
Yeah.
Great. I think that was one of my questions.
there is the option to risk rate the evidence individually.
Yes.
So let's say this question could be 4 or 5 different facets. We've got training, we've got this, we've got that, we've got a story I want to tell about Mrs. Smith who was moved between services. It all went really smoothly, although we strongly advise don't include anything personally identifiable in the evidence. So for GDPR reasons, you've got to protect people's anonymity, particularly service users or staff members. And if you include any documents or whatever, make sure that you cross out the names of anything that would be personally identifiable. The reason being, if at some point CQC come calling and the inspector says, well, share me your evidence, and they print a report from here with all their evidence on, and then the CQC inspector were to leave it on a train or something,
Yeah.
and it's got personal information in, that would be considered a breach. So you just got to follow the rules in terms of GDPR. So just be careful. Talk about a person by all means, but don't name that person. So we had an example working with a person, Mr. X or whoever that might have been, but don't name them individually or in anything on here.
Okay.
And if you have got multiple pieces of evidence, you might have 3 or 4 different aspects you want to talk about. Each one can have its own risk rating. If you hover over the risk ratings, it highlights how much of a risk there may or may not be from that particular evidence. And once you publish, and there's options to publish or save as draft. So once you publish, it will list all of the evidence with whatever ratings you've given. So I've now got, shrink that down a bit, 4 pieces of evidence. I've got a green, an amber, and a red. And then the provider can make their judgment on what that means for the question as a whole. In this case, I've taken the view that, oops, we've got no clear system. It's not where it needs to be. That's urgent. So I've made the whole question a red question, i.e. S2 as a whole as a quality statement. So how do we rate the question? How do we rate the individual evidence items? So you can break it down, but it's a judgment call. We don't automatically make the question red just because one of the evidence pieces is red. They might have 100 green bits of evidence and 1 red, in which case it'd be unfair to make it all red based on 1 piece of evidence. But then again, they might decide to, so we just give them the choice. So,
and would it be fair to say when they do upload evidence, most of the time it's because they are meeting that particular quality statement? Or would they still upload evidence, a little bit of evidence, and say, well, actually, we've got quite a big gap here, and then therefore rate themselves as red or amber?
I think it just adds context to whatever statement they've made. So it's reflecting reality, if you like, of what the situation is, whether they're good or bad. So I think it's additional assurance, if you like. It's supporting what they're saying, with real documents that, have you got an up-to-date safeguarding policy? Yes, we have. Here it is.
Yeah.
Is much better than saying yes, we have.
Yeah.
Because it's almost, well, what's the next question the CQC are going to ask? Well, can we see it?
Where is it?
Well, there you go. How do I know it's regularly updated? Well, there it is. I've opened it up. You can see it was updated last month. That sort of thing. So I think people will decide how they want to use it best. And there's a lot of latitude in how some people use it. Some people might use it differently to others. Some people might just start with the RAG rating and not put any evidence in at all, which is entirely up to them. Some people might have 10 pieces of evidence. Some people might have 1. It's up to you. It's your system. You use it as you feel most confident. We've got the framework. I think personally more is better than less. So a clear picture that addresses all the aspects of the quality statement is where I would go with it. But in the real world, I quite understand that time is limited, that the people filling this in, like the registered managers, have limited time available. So writing War and Peace against every equality statement might be difficult to achieve.
Definitely.
So 2 or 3 statements with the headlines is probably the sweet spot. More than that for the really good ones, less than that. And you're starting to say, well, have you really answered all of the questions? But it's an opportunity for them to tell a story. So what's the best bits? Or if you're aware that it's not a strength, what are you doing about it?
Yeah.
And that's when the action plans come into play.
On the evidence,
yeah, go on. Yeah.
My questions were, if I put some evidence in, but I put the owner as somebody else, so if I put it in and put it in as Nige, do we both get email reminders and it goes in your notifications, or will Nige just get that?
Only the owner. So if you give it to Nigel, he'll be the one getting the reminder. Excuse me.
Thank you. I thought that was the case. And the email reminders come up because a couple of weeks before the valid date.
So you've got a 4-week window. So the valid date, if it's within 4 weeks, you normally get a reminder 4 weeks saying your evidence is becoming due for review, and then on the actual valid to date itself.
Great, thank you. When you get to the review date and you do review something and change something, where does you want to keep what you did previously and create a refreshed evidence? Where do you kind of log things and where does it automatically go, if that makes sense?
Okay, so in that scenario, I'm looking at a piece of evidence. If I wanted to keep that,
yeah,
and then create a new version, if you like, then I either just click add evidence over the top. If I wanted to retain what I'd said before, I could copy that, open a new evidence item, and just paste it in. So I've now got basically 2 duplicate pieces of evidence. But then with the original, what I'd do is probably pop the original into the archive. So I would just hit the bin. So I've got then 2 versions. I've got the one in the archive. So historically, that's where we were at that point. But then I've used some of the content and copied and pasted it into new evidence item.
And if it's changed, then you just elaborate on what that statement is.
I think most people who use this are just updating the existing evidence.
Right.
Because otherwise it just gets very big and elongated. So the important thing is where we are now. But if they are really keen to retain something they've done, then that's what the archive is for, so they can pop it in the archive.
So most people are going in, reviewing it, tweaking if they need to, and just putting in another fresh date rather than going through that process. But if they want to, that is the way to do it.
Yeah.
Okay.
And then I normally make the point that the evidence that they've created generates a to-do list, a task list, which is on their home screen. So depending on whether they've saved it and published it or whether they've saved it as draft, all of those jobs which are owned by them, either they've been assigned to them or they've owned them themselves from the start, are just listed on that to-do list. And it's easier for people once the system is populated to just work through the notifications to update their evidence. I can see this has gone a bit overdue. Make whatever changes, remind me again. And in terms of reminder dates, again, that's up to the individual provider, how busy they are, how often they want to update it. I normally say we have variants. I'm aware of people who use 3 months as the maximum. I'm aware of people who use 6. I'm aware of people who use 12. But I wouldn't advise going beyond 12 months. So you can say to CQC, you look at every evidence item at least once every year. But if it's urgent, then set a reminder date much nearer the time. So remind me in 2 weeks, 4 weeks, whatever.
That's helpful.
Now, I've got a demo in 3 minutes.
Fine.
If
Are we
you're
okay
free,
to?
you could jump in and
I
watch
was
the
going to
demo if
ask
you
you,
like. We can
yeah, if I could do that at some point. So that's great. And then if possible, whenever you can, could we put a little bit more time in to go through the rest of the system? I know
Yeah,
I'll probably see some of it on the demo about to do, but I've got a few more questions
for sure.
for you separately. So yeah, I will join if that's okay.
Yeah,
I'll
that's
just say
fine.
be a silent watcher.
Okay. I'll
Fab.
share the link with you and then yeah, join you again in a couple of minutes.
Perfect. I'll just grab a drink. Thanks,
All
Paul.
right.
I'll see you in a sec.